Hi, it's Dr Gelderman here, and I wanted to talk to you today about when to worry if your pet refuses to eat. And that's the question we get on the phone again and again and again. It's a very, very common question. When to worry if your pet refuses to eat. So let me introduce you to Lola. And Lola has one eye, not many teeth, has a major heart issue. She's on 3 medications a day. She has fainting episodes, but she runs the household. She's a fantastic 15, 16-year-old rescue pet, and she's got a brilliant quality of life in spite of those things that I just mentioned. So out in the wild hundreds of thousands of years ago, in order to stay alive, you had to, in order to maintain your strength, that meant eating whatever you could as often as you could. After all, food was scarce. Therefore, healthy dogs and cats are generally good eaters. And so a decrease in your pet's appetite is most often a sign of some underlying medical condition. And when Lola came in, she wasn't eating well, and that's when we started to do these investigations. So if your pet appetite changes, then like Lola, you need to book your pet in to see us. If your pet is picky, it's not so urgent, but if the change is sudden or dramatic, then it's an ASAP. So what if my pet is not eating? Okay, that's the next question. What if my pet is not eating? Just off the bat, that's a really difficult question to answer. There are so many potential causes for inappetence or not eating in pets, and it's crucial that each situation be individually, fully and carefully investigated. The exact treatment of a change in appetite really depends on the underlying cause. For many picky eaters who are otherwise healthy, you simply change their diet. And changing their diet a little bit can improve both their appetite and their general health. Be aware that, as with most things in life, with commercial dog and cat food, the cheaper the cost, the lesser the quality of the food for your pet's good health and long life. In other words, you get what you pay for, okay? And generally speaking, the supermarket quality foods, in my opinion, are of a significantly lesser quality than the ones you'd buy from your vet, from us, or from a specialty pet store. So most healthy dogs and cats love meal times. That's why a change in appetite, either an increase or a decrease in appetite, but especially a decrease interest in eating, is something pet parents and we veterinarians must really carefully and closely monitor. Gone are the days of the 70s and 80s and 90s during which many pets with a decrease in appetite were simply given a jab of some sort of multivitamin and they were sent on their way. Modern veterinary medicine now allows us to carefully investigate the causes of and reasons for a decrease in appetite. And we'll talk about them shortly. And then we treat them specifically and appropriately. Cats especially, now dogs can go without eating for 3 or 4 days before they get really sick, but cats especially cannot go long without eating before they're at risk of developing a really, really, really nasty disease called hepatic lipidosis. It's also called fatty liver disease. So the next question is, what types of lack of appetite or decrease in appetite are there? And there's actually 3 different forms that your pet's lack of appetite can take. The first one is anorexia. This is a complete lack of food intake. There's no such thing as partial anorexia. You're anorexic or you're not. And if your pet is anorexic, I need to see your pet urgently. Number 2 is hyporexia. This is a reduction in food intake, regardless of the reason or the cause. This may be serious, but if it continues more than a few days, I do need to know about it and I do need to see your pet. The third fancy name is dysrexia. This is a distortion of normal appetite or a distortion of normal eating patterns. For example, a dog who refuses to eat his regular or her regular diet but will eat, for example, cooked chicken and rice. As with hyporexia, if a pet has dysrexia, I need to see your pet, but it may not be that super urgent. Now, there are 8 possible, very hard to do the 8 with Lola in my lap, but there are 8 possible reasons for a pet refusing to eat. Now, there may be more, but I've classified them as 8. Now, while it's really important to keep these terms in mind, what's most important is that when a pet's appetite suddenly decreases or disappears, we need to find the root cause. In the vast majority of cases, when a pet loses interest in eating, it's a symptom of an underlying deeper medical problem. We need to discover the precise reason, and we need to treat it appropriately and specifically. Now, we'll go through these 8 potential triggers, and the first one is pain. A painful condition anywhere in the body, especially in the gastrointestinal tract, can cause your cat or dog to eat less or refuse to eat at all. This is one of the most common causes of both anorexia and hyperexia. Number 2 is nausea. Now, this isn't particularly common in dogs and cats, but it can certainly put a pet off his or her food. Now, unless there's an underlying cause, nausea most often accompanies car travel, car sickness. There's now many highly effective remedies for car sickness in pets that will prevent nausea and help your pet to continue eating. The third reason is illness. Any pet who feels sick will often show little or no interest in eating, just like us. Sometimes it's just a passing gastrointestinal disturbance, and other times it's much more serious, such as liver or kidney disease or possibly even cancer. Number 4 is a fancy word called obtundation. Now, this describes a lack of alertness. It's worse than a little bit of lethargy, so it's a lack of alertness, and it's usually the result of an underlying medical condition. Things like trauma and things like hypercalcemia or increased blood calcium can cause obtundation. Number 5 is dental or gum disease. Now, sometimes a problem in your pet's mouth can make eating unbearably uncomfortable, and they'll either decrease eating or they'll eat less, or they'll only eat certain kinds of foods. Now, this can be as simple as a broken tooth or a loose tooth, or it can be as severe as severe gum disease, an oral cancer in the mouth, and we've had a few videos on that, or a condition such as feline stomatitis, which we'll do a video on shortly. Number 6, recent vaccination. Even though modern vaccines are very safe and rarely cause any sort of side effects at all, unlike the older vaccines, a loss of appetite can be a very short-term result of vaccination. Number 7 is stress. If your pet is feeling stressed for any reason at all, he may change or she may change her food behaviour. For example, some dogs don't have much of an appetite when they're in an unfamiliar place, like a boarding kennel, or when their favourite human is away from home. Your cat may refuse to eat if her food bowl is placed in a high traffic area, or if there are other pets around at meal times. And then number 8 is food aversion or pickiness. Food aversion can occur if you make a sudden change to your pet's diet. The watchword of changing a pet's diet is do it slowly. It's almost never a good idea to change any pet's diet quickly, because it often causes tummy upsets like diarrhea. So if you want to change a pet's diet, if you want to change what you're feeding your pet, do it gradually by mixing a large proportion of the old food with a little bit of the new food, and over 3 or 4 days, a lot of the new food with only a little bit of the old food. So slowly transition. Some pets, especially kittens, refuse to eat certain foods for reasons that may or may not make sense. Now, for example, with kittens, they have a shape preference. So in other words, they like certain shapes, and if you give them a food with the wrong shape, they won't eat. Maybe exactly the same food, but if it's in a different shape, they may refuse to eat. So with adult cats, if you give them cubes of meat rather than strips of meat, they're a lot less likely to eat it, because cats have a lot of shape preferences. Now, in many, if not most cases of pickiness, this situation, be careful now and listen to me. And I know there's people out there that are not going to like what I'm saying, but in many, if not all cases of pickiness, this situation has been originally caused by an owner who is overzealous with their young kitten or their young puppy, and they cater to that puppy or that kitten's every single whim. They run around with their chef's hat on, catering to that pet, and the pet then learns to treat you, the owner, as their personal chef. And we see this all the time. Many of these pampered pets end up regarding their pet parents, like I said, as their personal chef, dedicated to always catering to every food need, want, and desire. My advice with a new puppy or a kitten is that you make that pet fit in with how and when you want him or her to eat, and what you want him or her to eat, not vice versa. The next thing I want to talk about now is that a loss of appetite means that you need to come in and see me. If your pet loses his or her appetite, you need to come in and see me with your pet. If your dog or cat refuses to eat for longer than a day, especially if there are other symptoms or if there's a sudden noticeable reduction in food intake, you need to see me right away. If the decrease is gradual, it's just as important to get him or her checked out, but it's not as urgent. It's not as if the food drop-off was sudden or dramatic. It is crucially important that together you and I investigate thoroughly and find the underlying cause of your pet's loss of interest in eating, because there almost is one, and his or her appetite isn't just likely to come back with no treatment at all unless we solve the problem. We need to identify it and address it specifically, treat it, and then your pet's appetite will go back to normal. Now, I really want to address a quickly want to address a fallacy. As tempting as it is, I'm just going to put Lola down because she wants to go. As tempting as it might be to use various home remedies or internet research to treat your pet, it is really important to know that most appetite stimulants, which were originally designed as antidepressants and other various treatments prescribed by the great Dr. Google, can be useful in the short term, but they don't address the underlying cause of the inappetence. In other words, they may for a time successfully treat the symptom, i.e. refusal to eat, but they're not successfully treating the cause. Pursuing this line of treatment is in fact doing your pet a huge disservice. Now, speaking of treatments, what treatments can you use? When it comes to treating a patient that won't eat, there is no one-size-fits-all approach. I perform a comprehensive and thorough physical examination and a comprehensive diagnostic workup. I might even need to run some blood tests. I might even need to do a fecal examination. I might need to investigate some metabolic changes such as high blood pressure in your cat or dog. I may need to look at calcium levels, potassium levels. I may need to check out anemia and various causes of vomiting. We also need to consider any medication and or supplements that your pet is taking, just like Lola, to rule those out as a possible cause, because some medications can interfere with appetite. And we also need to investigate causes to the home environment and to the home lifestyle. You'll need to thoroughly brief me on any changes that may have occurred in your household, in your daily routine, in your pet's daily routine, which may be causing stress for your pet. And that especially applies to and for cats. I've seen cats stop eating when kids have uni exams. I've seen cats stop eating when the lady of the house gets pregnant. So that's how easily some cats get stressed. Now, the cause of your dog or cat's disinterest in eating is going to determine what the appropriate treatment approach is going to be. If there's an underlying disorder that we can successfully treat or manage, then your pet's appetite should really quickly pick up as the condition resolves. Now, I just want to talk about the fact that sometimes inappetence or not eating disappears with a change to a better diet. I mentioned earlier that food. We talked about food quality earlier in this video. Needless to say, the diet that you feed your pet plays a huge role in both maintaining his or her interest in food overall, as well as his or her ability to live a long and healthy life. The more you pay for the food, basically the more you pay for your pet's food, the better quality it is, the kinder on the body it is, and the longer, happily and healthier your pet is going to live. Now, since less appropriate foods, and read here the cheap foods, since less appropriate foods, cheap foods can overload or overwork certain internal organs, especially kidneys, especially liver. This can lead, in many cases, to premature failure or wearing out of those organs. I always recommend a nutritionally balanced, diverse, species-appropriate, fresh food diet combined with a complete balanced dry food, which also has plenty of chewing exercise to maintain healthy teeth. Over the years, I've known many dogs and cats on processed diets that were considered, fussy eaters, or that spent much of their time playing with their food, as much time playing with their food as eating it, in fact. And when the owners, under my guidance and advice, gradually transitioned those pets from a kibble or feed grade canned diet to a nutritionally balanced, diverse, species appropriate, fresh, raw or gently cooked fresh food combined with a complete and balanced dry food, the weird eating habits in many, many cases went away. So if your cat or dog gets a clean bill of health but still isn't eating well, we need to review the diet that you're offering. So that's the summary, if you like. So if you have any questions on the matter of diet and what to feed your pet, please give me a call, drop into the practice, talk to one of the nurses. We're always here to help you out. See you on the next video.